Hi guys, welcome back to my channel. It's Dr. Nina here. So today I'm meeting up with Katie, and her main concerns is basically the lower face. So she had some toxins, some Botox done previously, but what she's not really happy with is the mid and lower face and the cheeks. She thinks they're too flat, the areas around the mouth. She's not quite ready to have a non-surgical procedure in terms of lifting, such as PDO threads or endolift. However, she's very keen to have a little bit of a touch-up of fillers to try to soften all those areas of concerns. So what I'm going to do today to her, it's a combination of dermal fillers based on hyaluronic acid. So I'm going to do a bit in the cheekbones, in the nasolabial folds, marionette lines, and in the lips as well. Okay, so what I'm noticing here is a bit of volume loss in the lower mid face and lower third of the face. There's initial gels appearing, especially on the left side, and these classic nasolabial and marionette lines, which I think as well, you Katie was saying that you notice the most. So I think what we can do nicely with derma fillers is place a couple of very clever injections around your cheekbones to literally create a vector that will lift your mid-face. There's also a bit of a tear trough appearance, so I think by doing placing some layers of fillers here, it will just help to support and lift, which will give you a really nice heart shape, and at the same time it will also fill the nasolabial and marionette lines. So that will be my first treatment to be done. Then I'm going to actually, as I'm chatting, I'm going to mark you the marginal inferior border of your cheekbones, where I'm going to place the first injection to lift, and then I'm going to draw a line which will define the lower part of the cheekbone. Lovely. Okay. Same on the other side. I palpate and mark so I know exactly where I'm going to lift. So I'm always very cautious about injecting in the nasolabial fold, which in essence the nasolabial fold or nose to mouth lines are these creases here. The reason why those lines there appear is because over time there's some collagen loss, some gravity, so the cheekbone descend and they create this. So it makes sense, instead of keep filling just those lines, is to create a vector of lifting so those can look more natural. So if we do this first, then we need to inject less in the nasolabial and it looks more natural. Same thing for the marionette lines or mouth to chin lines. Again, there's a ligament that runs through here, almost like blocks the tissue. So when they start to descend, they create this pouch. So I'm going to create a nice vector coming from the bottom to kind of feel and lift this area there. So normally this will be my favorite approach at the beginning to deal with lower face, I would say initial sagging, and then obviously if we take a step further, then we can explore other procedures such as PDO threads or endolift that will actually give a degree of skin tightening on the lower face. But as she clinically presents now, I believe this will be the best treatment. Lips. Okay, so I think genetically you have quite small lips. So have you ever had any lip fillers before? You did, yeah. Right, which in fact, as I'm looking closely, I can see, because there's a tiny bit of migration above the vermilion border. So what we aim to do is to roll the inner mucosa outwards. So you do have a very tricky shape called the M-shaped lips. So what that means is that it takes time. It will be a process, a journey to build your lips. If we inject a lot, it may just migrate, so we just need to build it really slowly. I will do a combination technique of cannula and needle to give some volume horizontally and to try to roll outwards as well. Perfect. Okay, let's go into it. So just lay down for me. Okay, so I'm gonna start with the cheek filler procedure. So as she's experiencing initial skin laxity and volume loss in the middle of her face, we want to go with some HA, hyaluronic acid dermal fillers to create some vector of elevation and lift. So I'm gonna start to place the first kind of couple of boluses in the inferior margin of the cheekbones, which will give an instant and nice, very natural lift. Okay, so you got your stress ball, you're ready? And perfect. Okay, you okay? Yeah. And then a very gentle pressure. There is some anesthetic mixed in the filler, so as I'm injecting, you can see she's completely comfortable because the anesthetic is working. We have placed as well some topical one. Lovely. Okay. Feeling okay? So if you come from here, if you elevate your chin slightly, so you can already see the difference just with literally half of a mil placed in the correct spot, which is the apex of her cheeks. Already that has just helped to lift this cheek, and you can tell already from this angle. Okay, now I contour the side of the cheekbones. So I created the apple of the cheek. Now I'm just gonna go and give her a nice lift. Okay, well done. So on the cheeks, I like to combine two different techniques, which is needle and cannula. So the needle allows me to be very precise, and that's my choice when I create the apple of the cheek. The cannula, it is really safe, and I prefer it when I have to distribute larger amount of fillers to really contour the cheekbones. And it allows me to create also different results. If someone wants a very natural result, I inject more lower. If someone wants more pronounced cheekbones, I will inject a little bit higher. Fitting okay? Yeah, well done. Lovely. Just a little pressure, doing really well. Lovely. Okay. So one side is done. Lovely. Okay. And then just straight me. Lovely. Penny, okay? Yeah?
Yeah.
Perfect. I'm just going to show you. So stay there for me. So, there you go.
Oh my God, that's amazing. That's amazing.
I know. Looks really good, doesn't it? I know, they just has lifted everything really nicely. And it's just going to look better and better. Of course.